Orientation will be your first real links to the NHS, your first few months on the scheme. It's 20 days and it's an absolutely unique opportunity to go and view all aspects of the NHS at the very, very start of your time on the scheme.
It's a kind of way to see everything that you might not see in your day-to-day role, but it's a good way of finding out how everything works in the hospital, in the PCT, in the SHA in general.
When we started in the NHS, we had an orientation period, which meant that we could go and see lots of different parts of the NHS to really get a full understanding of how it worked. So we do things as varied as going to watch surgery and visiting wards, to also going to see different charities and different parts of the NHS to really understand the range of different work that we do.
What we try to do is to help the trainees follow through a patient pathway. So from admission via the ambulance service, they get to go out on an ambulance on a shift with a crew, through to the emergency department, going into the majors and minor areas, seeing what happens there, following a patient journey through to a ward, where we may ask them to work as a healthcare assistant for a couple of shifts to get the reality of what it's like to do that kind of work and interact with the patients. Through to discharge, how that's planned, and how patients actually get home, or whether they're transferred somewhere else or something else needs to happen to them. And then we also look at how they transfer into the community, what care happens there. We try to get the trainees to visit mental health trust as well, so they get some idea of that aspect of the NHS. And also try to involve the trainees in some strategy meetings, so they go to some high-level meetings within the organisation, they go to a board meeting, they go to the operations committee, and so on, to actually start understanding how decisions are made, how the strategy is set, and where their role eventually within that's going to fall.
It was really interesting, totally new to anything else I'd ever done before. So we basically shadowed different clinicians, managers and staff throughout the whole of the trust. So this involved going to different wards and having been training on the day. I was a cleaner for a day, which was really good. And I also shadowed in theatres, watched the operations, and I went to view a forensic mental health unit as well, which was just things you'd never get the opportunity to do in any other role.
Orientation is absolutely brilliant, and I gained a huge amount from it, and actually since I did it, lots of clinicians that I've spoken to have been really impressed that we actually had that opportunity. It gives us quite a lot of credibility.
During my orientation, then a couple of my favourite things I got to do were I spent 2 days in theatre, spending time with the different surgical teams, so orthopaedics, general surgery, brain and spine surgery and bariatric surgery. It was really, really interesting, and it was a really good insight into the way that the NHS works and the way that different staff in the NHS work together, because obviously a theatre team is made up of very different groups of people.
It's very easy to think of it as nurses and doctors, but a lot of it is around support staff, the complexity of the organisation. So it's really about beginning to understand different elements of the NHS, how it operates. Some of those will be clinical, like a ward or outpatients or A&E, but also around some of the support services like finance, informatics or HR, which are a vital part of delivering good patient care as well.
There are times though when things change, particularly when you're going to visit wards or accident emergency, events are always happening, but you just adapt to that and find other things to go and do, but everybody was really welcoming and supportive.
Be quite imaginative, follow up areas that you are interested in and you think might be of particular value in your placements. You should have some idea of what you're going into.
Whoever you're supposed to be going to see, always give them a ring the day before or a couple of days before to make sure it's still going ahead, because obviously people are quite busy and may have forgotten. So that's probably the number one tip, is ring ahead before you go anywhere.
I think really try to experience everything you possibly can. You're never going to have the opportunity again to see so many facets of the NHS. It's the only time you do get to be able to dip into mental health, to acute, to community services, to strategic services. And there is a place for everyone in the NHS, and it's your chance to find where your niche is. So I would say while you're on the scheme, use it as a testing ground. And even if a particular placement or particular experience isn't exactly what you hope for, it's the learning from that about what it is you do want from the rest of your working life that's really important.